February is American Heart Disease Month. And are you aware of the statistics and the numbers that you should know about? I'm Deniece Barnes, host of Take 10 on Tuesdays with the Tennessee Tribune. With me today is Dr. Keith B. Churchwell, Executive Director and Chief Medical Officer at Vanderbilt Heart and Vascular Institute. And he's also a member of the American Heart Association's Greater Southeast Board of Directors. Dr. Churchwell, welcome to Take 10 on Tuesdays with the Tennessean. How are you?
I'm well. Happy to be here.
Great to have you with us. We first off want to talk about the heart disease risk factors and which ones are worse for African Americans. Doctor, can you please elaborate?
Well, to say which ones are worse, that's an interesting way to put it. I think all of our risk factors affect African Americans to a significant degree. When you look at an African American population, hypertension probably is probably the most widespread and is prevalent in our population and is a significant risk for cardiovascular disease. But all of them, diabetes, hyperlipidemia or high cholesterol, smoking, obesity, these are all significant risks for cardiovascular disease and all have a tremendous impact on the African American community.
And what are ways that we as African Americans can help alleviate these symptoms and these diseases from heart disease?
That's a good question. One of the big ways is actually to understand that you have these diseases, see your physicians or your professional who takes care of you in regards to your medical care, and to take your medicines and actually take that advice that they're giving you in regards to reducing your overall risk for a cardiovascular event. If you have high blood pressure, you need to take your blood pressure medications and also decrease your salt intake, which for African Americans is significant in regards to having an impact in terms of their blood pressure. If you are overweight, it's time to get up, get off the couch, and start an exercise program. If you have diabetes, controlling your diabetes is extremely important. So taking your medications, weight reduction is vital. If you have high cholesterol, reducing the amount of cholesterol in your diet, and also taking medications that actually will decrease your cholesterol, but also importantly, decrease your chances of having a cardiovascular event is extremely important.
Dr. Churchwell, you recently spoke about the medication. I've heard of so many people who feel a little better and decide they're going to stop taking their medication at one point or another. What are the risk factors for doing that?
Well, one thing to remember, especially about hypertension, high blood pressure, it's a silent killer. So you may feel well until that particular event, and that event could be a heart attack or a stroke, and those are devastating consequences about not treating your blood pressure. In 2013, there are multiple medicines that can be taken that have a minimal side effects in regards to how they affect you on a day-by-day basis, but it can have a tremendous impact in decreasing your blood pressure. So finding the right combination of medicines to treat your blood pressure is important. If you're having a difficulty with one medicine, the thing to do is not just to stop taking it and not let your physician or provider know that you stopped taking it, but you need to let them know and get back to them and understand what are the other medicines or possible combinations that can be really helpful in terms of treating your blood pressure.
Okay. Now, heart disease has often been referred to as the man's disease. Talk to us about the difference between the woman's factor and the man's factor regarding heart disease.
So I never think of it as actually a difference. When you look at the data from a population standpoint, the biggest killer and also the biggest reason that African American women have significant issues, morbidity and mortality from a disease state is cardiovascular disease. You have the highest risk. It is the highest number of individuals in the population especially for African American women and for African American men in regards to killing in the population, and also the complications that occur with stroke and with ischemic heart disease, leading to significant morbidity.
Again, we are speaking with Dr. Keith Churchwell, Executive Director and Chief Medical Officer at the Vanderbilt Heart and Vascular Institute. Dr. Churchwell, what can we do to reduce our risk? What are those numbers that we talk about often?
So the numbers to remember. When you think about your blood pressure, ideally we'd like that top number, the systolic blood pressure, to be less than 140, ideally about 120, and we want that bottom number, the diastolic pressure, to be less than 85, but ideally less than 80. So the ideal number is 120/80 in terms of your blood pressure.
Okay.
For your cholesterol, if you've never had a cardiovascular event or a heart event, ideally, you want your total cholesterol to be less than 200. From a cardiologist perspective, we like it less than 160 milligrams per deciliter. We want your bad cholesterol to be definitely less than 160, ideally less than 130. If you've had a cardiovascular event, what I mean by that, if you've had a heart attack or you've had an acute coronary syndrome, if you've been to the hospital and had chest pain and been evaluated and told that you have cardiovascular disease, ideally the total cholesterol should be less than 130, and the bad cholesterol, the LDL, the goal is less than 70.
Okay. At one time, Dr. Churchwell, people referred to the heart disease and strokes and diabetes as an old person's disease. I've known younger people to actually get this disease and possibly die from them. Talk to my listeners and my viewers about these numbers.
Well, when we look at what people die from, and we're talking not only the old, but the young and the middle age, we know that cardiovascular disease by far, if you actually roll up all the other disease states, for example, cancer, and ask which one you are at greater risk for, all the cancers put together don't equal the incidence of death from cardiovascular disease, and that's across any age range.
I see.
So it's not just an old person's disease. You'd have to ask yourself, I ask my patients now, how do they define old? I don't define old. I try not to, as I grow older, to define people as being old anymore from that standpoint. Because what we're looking for is not only quantity of life, but quality of life. And having one of these events affects the quality of life significantly. So the idea is actually to prevent one of these events from occurring.
Okay. Now, Dr. Churchwell, in wrapping up this interview, tell my viewers what are some things that you would suggest to help alleviate heart disease?
So number one, look at your diet and ask yourselves in regards to your salt intake, in regards to the amount of cholesterol in your diet. These are things that you can actually have a significant impact on in regards to reducing. You can change your diet, number one. Number two, think about exercise. What I'm not talking about going out there and saying to yourself, tomorrow or next week I'm going to run a half marathon. That's unrealistic. But beginning a process of 15 to 20 minutes a day of a walking exercise to begin an exercise program is key. It's vital. It's amazing what one can do in terms of weight reduction, in terms of increasing your overall cardiovascular health by starting just a regular walking regimen. We can all walk, hopefully, at this particular point, and that is extremely important. Knowing your numbers, as we've talked about before, is vital because that's a conversation you should have with your physician and primary care provider in regards to, are you hitting your numbers, and if not so, how you can make those changes in terms of your lifestyle, your diet, and medications to make sure that you're hitting your numbers. And also take that information and bring it to the rest of your family. Because if you have high blood pressure, or if you have high cholesterol, or if you've had a cardiovascular event, realize that there are members of your family who are also at significant risk.
That was actually my next question and or comment to you. So heart disease is hereditary.
There are aspects of heart disease that put you at greater risk for an event that are hereditary, yes.
Okay. All right, Dr. Churchill, let my viewers know how they can learn more about you and your works.
Actually, that's a good question. I'm at the Heart and Vascular Institute at Vanderbilt. You can go online to www.vanderbiltheart.com to get more information about what we do and also information in regards to what is happening at the Heart and Vascular Institute. If you want more information about heart disease in general, you can go to our website and also the American Heart Association's website and get actually great information about heart disease and what you can do to affect your overall risk.
Although February has been deemed the official month for American heart disease awareness, Dr. Churchwell, I think every month people should be aware of this disease because it is serious. Wouldn't you agree?
That's actually quite true.
Again, I want to say thank you so much, Dr. Churchwell, for joining us here on Take 10 on Tuesdays with the Tennessee Tribune. It's been great, and we'll be having you back again very soon.
My pleasure. Thank you.
Thank you.